I'm joined now by Dr. Rajiv Jain talking about AGA's session, Disruptive Threats to Gastroenterology Practices. What are those threats?
Oh my gosh, those threats are numerous. But what I would do is I would synthesize it down to probably two major threats. And one I would call it is patient flow. So we all want to take great care of patients, but we get paid by taking care of them. And if we don't get those patients, our livelihood is at stake. And there are immense threats to how we can see our patients. And in the session, there'll be discussions about insurance exchanges. And these exchanges are going to change the way patients can come and see us, because it may limit which patients can come and see which practices because of this new concept of narrow networks, where they're limited in who the providers are that can see those patients.
So are you giving practices or the doctors who are running these practices a navigational tool to be able to figure this all out?
This is a process in evolution, and what the AGA is really doing is this thing called the roadmap to the future. And we will provide tools to clinicians to help them face these new regulatory burdens, burdens that are changing the landscape of payment. For example, currently physicians are paid in a fee-for-service, or what we call a volume-based mechanism. That's changing now to a value-based mechanism, where alternative payment models like bundling, things like that, is how we're going to be better paid to maintain the health of our practices.
Are there other disruptions you think that might surprise the attendees?
I think so. I think one big thing that we don't think about is that our patients are really becoming healthcare consumers. They are getting information from many different ways. They're looking at how we're rated. They're using social media. They're going to other internet or web-based products to read about their illnesses and ask us questions. And those changes in the healthcare consumer might change who they come and see, or which clinician they see, or which subspecialty they even see. So I think it's important that we also position ourselves in those venues of social media and of transparency, so that we can engage those healthcare consumers and bring them into the right physicians.
What other changes do you think need to be made in order to deal with these informed patients, informed consumers?
I think transparency is a major imperative. We have to be able to let the patients know how good of a physician we are, what quality we provide, and value, meaning what is the cost of our care. And those are all parameters patients want to know about now, because more and more patients have these high deductible health plans. So just like when you're purchasing a car, you're looking at the little sticker to see what's my mileage, what other things are you offering me, what's the quality of this vehicle, the value. I think you're going to see that in gastroenterology as well.
What do you think is the most important way AGA is really helping GIs prepare?
The most important way the AGA is helping clinicians is the roadmap to the future. And that contains many different facets to help the physicians. One is clinical guidelines that have clinical decision support tools. So when we're busy in clinic trying to see many, many patients, at that point of service, I need help to make sure I'm providing high value care. And the AGA is giving me those tools by producing high quality guidelines with accompanied clinical decision support tools. Another aspect of the roadmap is dealing with the change in payments. So helping us with the framework for bundled payments for colonoscopy, for colon cancer screening. There will be a new one coming out for gastroesophageal reflux disease, or GERD. And other bundles are being proposed right now, for example, obesity. So with these different toolkits to help us both on reimbursement, on taking good care of our patient, I think the AGA is really moving us forward to helping us be outstanding value providers.
It's so nice to know that they have the support in the AGA. Thank you so much, Doctor.
It's been my pleasure. Thank you.